Back to my channel. In this video, we will explore what gout is, its causes, risk factors, symptoms, and most importantly, effective treatments to manage and prevent it. So, let's dive right in. Gout is a type of inflammatory arthritis that develops when uric acid crystals accumulate in and around joints, causing pain and inflammation. These symptoms come and go in periods called flares or acute gout attack. Uric acid is a natural waste product formed during the breakdown of purines, substances found naturally in the body and in certain foods including red meat, organ meats, and certain seafoods. Normally, our kidneys filter uric acid in blood into urine, but sometimes either your body produces large amount of uric acid or your kidneys are not able to excrete uric acid properly. As a result, uric acid levels in blood increases. It can lead to the formation of sharp, needle-like crystals in the joints, most commonly in the big toe but can involve other joints too, such as knees, ankles, hand joints, wrist, and elbow. Now let's talk about what are the risk factors of gout. There are several factors that can contribute to its development. Consuming excessive purine-rich foods like red meat, organ meats, certain seafood like mussels, codfish, tuna, trout. Drinking beverages sweetened with fruit sugar, fructose, can increase levels of uric acid. Alcohol consumption, especially beer, also increases the risk of gout by preventing kidneys to excrete uric acid. Obesity increases the risk of gout as our body produces more uric acid, making it difficult for kidneys to eliminate larger amounts of uric acids. Certain medical conditions can increase the risk of gout. These include untreated high blood pressure and chronic conditions such as diabetes, heart, and kidney diseases. Certain blood cancer also increases risk of gout. Certain medications such as low-dose aspirin and some medications used to control hypertension, including thiazide diuretics, angiotensin-converting enzyme inhibitors, and beta blockers, can raise uric acid levels. Men experience gout more frequently than women, largely because women typically have lower uric acid levels. However, after menopause, women's uric acid levels begin to resemble those of men. Men are also more likely to experience the signs and symptoms of gout earlier than women do, typically between the ages of 30 and 50. Some people have a genetic predisposition, making them more susceptible to gout. Gout is known for its painful symptoms. Here are the common signs to watch out for. Sudden and severe joint pain, often in the big toe. Swelling and redness in the affected joint. Limited range of motion in the affected joint. Warmth and tenderness around the joint. These symptoms of acute gout may last for 10 to 15 days. In recurrent gout attacks, urate crystals can deposit outside of the joints and can be seen under the skin, forming small, firm lumps called tophi. The most common areas for tophi are over the top of the toes, around the elbow, ears, front of the knee, backs of the fingers and wrists. Tophi are usually painless, but can be painful during the acute attack. Treating gout is usually a combination of managing your symptoms during acute flare and preventing the risk of gout complications and recurrent attacks in long term. During acute flare, medications given to reduce the pain and inflammation are non-steroidal anti-inflammatory drugs like naproxen or ibuprofen are frequently given to reduce pain and swelling during acute gout. They work best when given in first 24 hours of an acute attack. Some people with kidney disease, stomach ulcers, and other health problems shouldn't take these drugs. Colchicine is another prescription medication that can reduce inflammation and pain if you take it within 24 hours of a gout attack. In patient with contraindications to other agents, corticosteroids such as prednisolone or Medrol is the next option. It can be given orally through mouth as pills, or can be injected directly into the joint or surrounding muscle if only one or two joints are affected. Drink plenty of water and avoid alcohol and sugary beverages. Apply a cold compress or an ice pack to your joint for 15 to 20 minutes, several times a day. Limit stress on your joint by avoiding intense exercise or physical activities. For preventing the risk of gout complications and recurrent flare, we need to treat the actual cause of gout, that is high levels of uric acid. For the patients having large deposits of tophi, has at least 2 gout attacks per year, or has chronic kidney disease or history of kidney stones, urate-lowering therapy should be started. It is important to know that all these agents can trigger gout flare at the start of therapy. Low dose of colchicine or non-steroidal anti-inflammatory drugs as a precaution against attacks can be given during the first 6 months of starting urate-lowering agents. Medications that block uric acid production include drugs such as allopurinol and febuxostat. Febuxostat is safer in the patients with renal impairment. Medications that improve uric acid excretion by the kidneys, also called uricosuric agents, include probenecid. These agents increase the risk of uric acid stones and is contraindicated in the patients with history of kidney stones. Avoid foods rich in purines like red meat and organ meats, such as liver. Seafood rich in purines includes codfish mussels, trout, and tuna. Stay hydrated by drinking plenty of water. Limit intake of alcohol and fruit sugar, fructose, sweetened beverages. Maintain a healthy weight through diet and exercise. Pick low-impact exercises that are easy on your joints, such as walking, cycling, and swimming. Gout may be a painful condition, but with proper management and lifestyle adjustments, you can lead a healthy and pain-free life. Remember, if you suspect you have gout or are experiencing symptoms, consult a healthcare professional for guidance tailored to your specific situation. That's it for today. If you found this information helpful, please give it a thumbs up and subscribe to my channel for more informative and health-related content. If you have any questions or topics you'd like us to cover in the future, please leave them in the comments below.